Welcome to the 2023 Global Health and Welfare Forum in Taiwan. This year, we are privileged to have 38 international renowned health experts, NGO leaders, and 28 health ministers and senior officials from 12 countries to share their insights with us. Thanks to your contribution. The forum will continue to be a growing platform for international cooperation in health.
For the past 18 years, the forum has provided an opportunity for opinion leaders, policymakers, and experts from across the world to address the most pressing issues of global health governance. The forum has firmly established itself as an indispensable global health event and an invaluable platform for the sharing of ideas and mutual learning.
To prioritize challenges in certain countries and regions is linked to political will and political decisions, choices to describe what matters for us, for people, and what we will deliver.
And fortunately, Taiwan has put the great effort to tackle the climate crisis. Like one, they have announced last year pathway to net zero emission in 2050 with 12 the key strategies.
We have to break down the traditional silos in which we work. We must bring together all of the appropriate expertise and authorities, and everyone who is in a position of power and who is concerned about the future of humanity must work to develop a shared understanding, because there is no alternative if we are to survive as a species.
If we want to have a strong and good global health governance, data and insight, digital technology and innovation, and digital environment can be contributing to that, but you need good governance at both data level, the technology, but also the ecosystem.
A digital global health governance is a three-body problem requiring interoperability and diplomacy among a multitude of stakeholders: industry, governments, academia, institutions, civil society organizations across the world.
We need to be there in global health governance because we need to have a policy which is fair and equitable. Women's leadership in global governance is critical to reach the 2030 agenda of Leave No One Behind. That's why we are all working together.
Democratic institutions, both nationally and at the global level. We have to take care of our democracies. I think it's very important for health.
We cannot say the future is safe if no country is left behind. Collaboration is required. That must be our next mission, to overcome the challenge ahead of us together for the safer future.
There's a lot of talk about global health policies, or how important it is to act globally when it comes to prevent, prepare for, and respond to global health threats. But I repeat what I said last year, and that is my point. There is no global health policy without Taiwan sitting at the table.
And definitely we remain committed to ensure that we can continue that partnership and collaborations with Taiwan and other countries within our region to ensure that we could strengthen our health systems within our countries.
For us, if we to talk about universal health coverage, nobody should be left behind, nobody should be left outside any forum. So I will propose that we don't stay only on inequality, but we also emphasize the point of inclusiveness.
My notion for inclusiveness is the governance of global health. So governance of global health should be inclusive of key actors, and I mentioned Taiwan as an example. The governance of global health should take into account inclusivity.
I'm pleased to see that we have reached the consensus on ministerial joint statement, and this year marks the 19th anniversary of the Global Health and Welfare Forum in Taiwan. And this is the very first ministerial joint statement we have ever made. Thank you all for joining and making this statement a reality.
I think we had a great working session. With the help of all of you, we got together a statement that is entitled Health for All, Strengthen Well-Being Through Collaboration and Empowerment for the Attainment of New Normal. And I think that even our process was a good example of collaboration.
Taiwan seeks to work with its partners through diversified, pragmatic actions and demonstrate that Taiwan can help and Taiwan is helping. We firmly believe that Taiwan's endeavor can make a meaningful impact on the sustainable development goals. Thus, Taiwan will continue actively participating in international health affairs and sharing expertise and experience with global communities.